Sleep apnea, or chronic obstructive sleep apnea, is a situation in where you quit breathing during sleep. And there are lots of health risk and health factors that come into play for people with chronic sleep apnea. People with sleep apnea are at greater risk for high blood pressure, heart, cardiovascular disease, diabetes, decreased sex drive. There's a greater risk for driving and work-related accidents. Of course, snoring is one of the most common complaints that we hear, either from the patient or from the significant other. But when you have sleep apnea and you quit breathing during the night, your blood oxygen level drops. Your heart has to work harder, and you wake up many times tired. Sometimes you have headaches, you have sleepiness during the day, and it really affects the quality of life for the patient. Sleep apnea is a medical condition that has to be diagnosed by your physician medically, and that's usually done with a sleep study. Once you get a medical diagnosis of sleep apnea, the CPAP is the gold standard of care for treating sleep apnea. Most everyone is familiar with the CPAP device, the CPAP mask, but a lot of people cannot tolerate wearing the CPAP device and sleeping in the CPAP device. Some people are claustrophobic. Some people do not tolerate something on their face while they're trying to sleep at night. So with people with mild or moderate sleep apnea, a dental appliance is a very effective way to treat sleep apnea. When a patient comes in and seeks treatment from a dentist for a medical problem such as sleep apnea, we construct an oral appliance, and that oral appliance basically repositions the tongue and the jaw into a more forward position so that you can breathe at night. And when you breathe at night, your blood oxygen level stays up, your cardiovascular system has much less stress, less snoring, happier significant other, and all this leads to a better lifestyle, less symptoms, less problems that normally occur with sleep apnea. But some of our patients travel, some of our patients are claustrophobic, some of our patients cannot tolerate something on their face at night, so they are good candidates for the removable dental appliance in treating the sleep apnea. Once a patient gets a medical diagnosis from their primary physician that they have obstructive sleep apnea, then they may decide they want to check into a dental appliance as a form of treatment. And if you want more information on treatment of sleep apnea from a dental perspective, you can call our office for a free consultation, and we will discuss your specific case, your degree of sleep apnea, to see if you are a candidate for a removable dental appliance for the treatment of your sleep apnea.